Sort of strange on a Friday to be doing a show on anemia, but I haven't done one before. So I figured it was time to give you a physician's guide to oral iron supplements. You know, anemia is a common medical problem that's treated about 40% of the time in OB/GYN visits. Primarily, it's estimated that 25% of all women past the age of 13 or 14 can become anemic because of menstrual irregularities. There's a lot of other reasons for anemias. You know, we look at some of the issues evolving around cancer therapy, chemotherapy, and what it can do to your red blood cells. Iron deficiency, the most common cause of anemia, can be treated with oral supplementation. Less frequently with parenteral iron, giving it to you intravenously. And in certain situations, when it becomes desperate, post-surgical procedure, etc., a lot of times the body has a while to recover. So you become having the need to have IV iron. Because if you don't, the risk factors, including brain damage and death, can occur. So this is nothing to just be pushed aside. Supplements are especially important when an individual is experiencing clinical symptoms of iron deficiency anemia. No energy, pale, drawn, and you need to replenish those hemoglobin stores. So those of you that do look at your blood work, or you may review them with me, we look at hemoglobin, HGB, as well as red blood cell counts. Dr. William Urschler, a hematologist at the National Institute of Health, stated this, quote, "Once a physician has determined a diagnosis of iron deficiency anemia, searching for a cause of that anemia is as important, if not more important, than correcting the anemia." So again, it becomes crucial for the doctor to find out, why am I anemic? Typically, the thought process is there's bleeding going on somewhere in the body. Oftentimes with an ulcer or in the GI system, in a bile duct, it could be coming from in the kidney, come from a lot of different reasons. This can initiate a workup to get the cause of that diagnosis, to uncover the potentially curable problem before it progresses any further. Oftentimes, a referral to a gastroenterologist or to a hematologist may be necessary if the anemia is not easily detectable. So hematology is a part of the oncology group. In order for oral iron therapy to be effective and to resolve iron deficiency anemia, patients must receive and absorb an adequate dose of elemental iron. And that's the key factor that I think we all need to know. What is elemental iron? Keeping in mind that iron is not a normal flow of something our body takes in. We've had those old school thoughts of eating calf liver as a source of iron, spinach, the old Popeye concept, but there's just not enough in there to really substantially buoy it up. So it's a matter of, as God created our bodies can maintain for the most part, but if there's a leak in the system, it becomes a problem. Since most iron preps are non-prescriptive, physicians must provide their patients with an adequate education to ensure they're choosing the right form of iron. Taking it at the right time, minimizing the common side effects that can often lead to discontinuation of therapy. And the most common of those, constipation. The most common of those can be even internal bleeding. So we're trying to treat a symptom by maybe causing a bigger problem. So the most common form of iron that is prescribed by most doctors is called ferrous sulfate. It's one of the oldest, one of the least effective. And if you look at the charts for absorption, you take 325 milligrams to absorb 65. So you're absorbing about 20% of the elemental iron that's necessary to create a solution. So what happens to the other 4/5 of the iron? That's the irritation part that can cause nausea, constipation, distress, etc. So again, one of the oldest forms, one of the least effective. For adults who are not pregnant, the Centers for Disease Control and Prevention recommends 50 to 60 milligrams of oral elemental iron twice a day for 3 months as a therapeutic treatment to treat iron deficiency anemia. So about 50 milligrams a day. So it goes on to say iron supplements of 60 milligrams of iron, such as ferrous sulfate, can increase things after 24 hours if it can be tolerated. Now, in the news this morning that you may see or you may hear from your doctor the next time you have a visit, it's been said for decades that vitamin C does help with the absorption of iron. Let me tell you this. This is coming from the Society for the Advancement of Blood Management that works with hematologists. Factors that affect the absorption of iron supplements. Oral iron supplements must dissolve rapidly in the stomach so that the iron can be absorbed in the duodenum or upper jejunum. Enteric-coated preparations, which is most common in that ferrous sulfate form, they look like M&Ms. And long-acting supplements, and you'll see those in the store oftentimes, are highly ineffective since they don't dissolve in the stomach. Or if you're on an acid blocker, Prilosec, OTC, Nexium, Protonix, Prevacid, you're not going to absorb your iron. Ascorbic acid, now this isn't my normally recommended vitamin C form, but ascorbic acid, which is acid forming, is an enhancer of iron absorption and can reverse the inhibiting effects of substances such as T and calcium. Ascorbic acid facilitates iron absorption by forming a chelate with ferric iron at an acid pH that remains soluble at the alkaline pH of the duodenum. So again, it must be done in the stomach. To minimize the side effects, iron supplements are often taken with food, but again, to minimize the absorption with food, which can cut back in the absorption of the iron by up to 66%. Food and drug interactions are also a big problem with these. Physicians can help minimize the risk of treatment failure through the proper selection and dosing of iron supplements, along with educating patients on the strategy to maximize iron absorption, manage the side effects, and improve compliance. That's the facts, Jack. Now, in the Journal of the American Medical Association today comes this: adding vitamin C to iron supplementation doesn't seem to further improve hemoglobin levels in patients with iron deficiency anemia, suggests a Chinese study. Put much faith in this. Roughly 440 adults newly diagnosed with iron deficiency anemia. And I mean, these people were really anemic. You know, normal levels 30, 35. These were in the teens. Were randomized to receive 100 milligrams oral iron supplementation with or without 200 milligrams of vitamin C every 8 hours. After 2 weeks, the mean hemoglobin level had increased in both groups by roughly 2 grams per deciliter, with no significant differences between the groups. The author said the findings suggested vitamin C is not essential for those with iron deficiency anemia. We go back to, then, what do I take? If they don't want you to take, and they don't say that the form that they used, which was a ferrous fumarate, which is a highly ineffective form, ferrous fumarate absorbs at about 325 milligrams per, delivers 108 milligrams of elemental iron. That is if you can absorb it. That's if everything is stable. I'm going to say this. 9 out of 10 patients that I talk to don't have an acid median in the stomach to absorb iron. Now, what we recommend over and over again is called iron bisglycinate. Iron bisglycinate. Let's go over here. Iron bisglycinate. Well tolerated, gentle in the system, non-constipating, and in a capsule form for a reason. It has in it 60 milligrams of vitamin C as L-ascorbic acid. The most effective form of ascorbic acid that we could find, acid forming. It also has 400 micrograms of folic acid and B12 at 8 micrograms to help with absorption and producing red blood cells. And ferrous bisglycinate at 28 milligrams that absorbs at, you ready? 100% of elemental iron. Not 20%, not 30%, not 40%, 100%. So you can take a much lower dose and get red blood cells and hemoglobin levels back in the quickest period of time. That conforms with all of the levels that are necessary to be able to correct an anemia. So when you are dealing with something like this, it goes on to say there's a growing body of evidence supporting superior outcomes with intravenous iron, of course, especially in the chronic kidney disease and chronic heart failure population, which is burgeoning in this country. One should not hesitate to move to intravenous iron early as an alternative treatment when gastrointestinal intolerance, a poor response, or non-adherence to oral iron is encountered. There, I said it. And it's important. Now, one other thing that I want to bring to your attention today, if I can find it, is that New England Journal of Medicine finally recognized the fact that foods have various levels of inflammation potential. See if I can find this. Here it is. High intake of pro-inflammatory foods linked to cardiovascular disease. Diets with high pro-inflammatory potential are associated with increased risk of cardiovascular disease, suggests a study in the Journal of the American College of Cardiology. Pro-inflammatory diets, the standard American diet, include more red, processed, and organ meats, refined carbohydrates, sweetened drinks. In contrast, anti-inflammatory diets tend to include more leafy green and dark yellow vegetables, whole grains, fruits, tea, coffee, and wine. In the study, 210,000 U.S. health professionals who were free of cardiovascular disease at baseline completed food frequency questionnaires every 4 years for 32 years. During that time, 18,000 cardiovascular events occurred. After multivariable adjustment, risk for cardiovascular disease events was higher in those with a higher pro-inflammatory dietary score. In particular, compared with participants with the lowest scores, those with the most anti-inflammatory diets. Those with the highest scores, most pro-inflammatory, had a 38% increased risk of cardiovascular problems. You want a copy of the anti-inflammatory diet? Give us a call, 678-228-8900, 678-228-8900. Now, this is YouTube. Hopefully you have joined our YouTube world. I'm putting these out. I'm trying to at least 2 or 3 times a week. Tomorrow morning, Saturday morning, we will be live on Facebook at 9 o'clock. We're going to be talking about a lot of different things. I think I'm going to spend a little time on ADD, bipolar, sugar, autism, and the gut. There's a lot there. So we're going to get into that tomorrow. So make sure you're with us. That's at 9 o'clock tomorrow morning. Nutrition Shop's Facebook page. Be there with us, and we will share all the news that's fit to help you keep healthy. 678-228-8900, and the website is thenutritionshop.net. God bless you, folks. See you back here tomorrow morning, bright and early, 9 a.m. Eastern. Take care.